blood bank and pick up the blood. Okay. Now, before I do that, I'm gonna. You can use these little cards. That's what we have been doing in the past. You have to take a copy of the orders at the hospital. That's what people are used to, but it doesn't. I don't believe it says that on your checklist. If it does, then you can say I'm making a copy of the orders. I'm gonna write everything on there. So you just have this, and you do want to know your patient's blood type. Why?
Get the right type of blood.
Right. So we're going to write down that. You also want to know their H and H, so you can see why they're getting blood. And this person, Mr. Davis, is 8.2 and 25.1. His blood type is A negative. Okay. All right. So I'm going to go to the blood bank and pick up his blood. When you go over to the blood bank, you're going to have 4 units of blood, okay, and you have to pick the correct one, obviously. Okay, so what you do is you look at the tag and start with the name, Robert Davis, hospital number, medical record, F00712-367, bring your glasses, and Robert Davis, 712-367, date of birth 3/25/1948, so it has all that proper on there. Blood type A negative, that's the patient's blood type, and then this unit is A negative. I just happened to pick up the correct one. But you don't have to look through all of them if you're sure you have the right one, okay, just the way they're on the table. This patient's A negative, so could they take B positive? Okay, so we get rid of that one. This is O negative, could they have O negative? Yes. AB positive. Yeah. Okay. So he is A negative. He can only have A or O, and it has to be negative. So these two are our choices, but because he's A negative, let's just take his blood type, which is A negative, okay? So we have the correct blood, and when you're walking back to the lab, you want to inspect it back to the room for clots, bubbles, leaks. That's one of your checkoffs, I think. Make sure that the blood appears okay. Okay? When you're going into the room, you want to take a second nurse to verify the blood product with the patient. So I'm going to call in Nancy Nurse, and she and I are going to check the blood. Okay, so this is when you're doing this skill that you speak for both yourself and your second nurse. You can't just say it and then wait for the pretend. You have to say it for the patient. Speak for the patient. Okay, so I have Robert Davis. Medical record number F00712-367. Medical record number F00712-367. Date of birth 3/25/1948. 3/25/1948. Okay, so all of that matches. So you want to make sure that the blood bank paper has their blood type, the donor unit number, and the expiration date. And those are what you're going to check next. So I'm going to look at the donor unit number, 0003944, and I'm going to look on the unit. There's a bunch of stickers with it, and it's up here. So the donor is 0003944, and it expires today. Okay? Okay, so everything matches up. You can thank Nancy Nurse, and she can go. Then you're going to put on clean gloves. And we're going to spike our blood. So we won't use any of the ones that look like they haven't been spiked. I'm just going to use these again, okay? Okay, so you want to go to your other port. It's still clamped off. Spike your blood. So we want to leave this saline closed. We want to open the blood, and we want to run it through the tubing so that when we go to put it on the pump, the blood is already down here. Okay, otherwise we're going to have to wait even longer for it to get to the patient before we start our 15 minutes. Okay, so you're going to run it through until the blood gets about right above my hand. patient right up. Okay. All right, so we have our blood. With the Alaris pump to be, you guys are going to be responsible for doing this correctly too, okay? So make sure that you practice that. You're going to open it and you're going to put the blue cassette in. The long way goes in until it clicks. And then you gently lift it up until that disc rests in the top. Close it. Now once it's in the pump, you can open everything so that you won't forget to. You only want to open your blood, not the saline. Okay, once it's done, you turn on the pump. The first question it asks you, is this a new patient? Okay, so if it was in the room with the patient and it's his pump, you could just say no. And let's pretend that that's the case here. So it's still med-surg. It has some options, med-surg, critical care. So this was programmed for med-surg. We're going to say yes. Okay, channel select A is all this is the only channel we have, so channel select A. Blood is considered a guardrails IV fluid. P for packed red blood cells. Okay, and it asks me, was red blood cells selected? Yes, and it gives a clinical advisory to never run anything with your blood, so you confirm that you see that screen. And then it's going to ask you the rate. According to your skills book, we start blood at 2 mLs a minute, which is how much an hour? I'm going to put it in for 120 mLs an hour. And the volume to be infused is a normal blood bag is anywhere from 350 to 500. We usually put 400. It says on the bag, and I'll show you when we're in clinical how to figure that out. Doesn't matter though. Volume is 400. Okay, and then we're going to hit start. We're going to tell the patient if you feel anything that doesn't feel right, any kind of itching or hot, headache, back pain, let me know. I'm going to stay with you for 15 minutes. And I'm going to recheck your blood pressure after 5 minutes, again at 15. And when's the next one, guys?
30.
30. And then after the transfusion's ended. Okay?